Hello, and welcome to Alleviate Dry Eye, where you can learn to take care of your eyes like it's the only pair you'll ever have. I'm your host, Dr. Pam Terrio. I am the author of the book Alleviate Dry Eye and also a dry eye specialist here in Louisiana. Thanks so much for joining me tonight. We are going to talk about a new prescription medication on the market to treat dry eyes. It's called Tyrvaya, and it's a nasal spray. What? A nasal spray for dry eyes? Who would have thought? So I want to tell you a few things about it, how you can get it, and how to use it. So Tyrvaya, as I said, is a nasal spray. It helps you make more of your own tears. It's Tyrvaya, Tyrvaya. Anyway, so it uses a nerve that goes from, well, the brain to the eye, the lacrimal gland, and then it goes down your nose and ends right there. So if we stimulate that nerve, it's called the trigeminal nerve. If we stimulate it here, the signal will go back to the eye and then to the brain. So it will cause your eye to make more of your own tears. And why is that important? Well, tears are made of three major components. There's the watery component that comes from the lacrimal gland, a mucus component that comes from the front surface of your eye and holds the water on, and then the oily component that comes from your eyelids, your meibomian glands, and coats those layers and keeps them from evaporating. So there's three parts to tears: water, mucus, and oil, and over 2,000 components in your tears that include anti-inflammatories, antimicrobials, and things to protect your eye and bring it nutrients. So the tear is incredibly complex, and using an artificial tear does not mimic those 2,000 components that are in your natural tears. So that's why getting more of your own tears into your eye is so important, and why Tyrvaya is such a great tool to use to treat our dry eye patients. So it is especially great for people who hate using eye drops, or maybe are already on several eye drops, and adding one more drop just seems like a burden to the treatment regimen. Maybe patients who are already taking a glaucoma medication or are already on a significant regimen of dry eye therapy, including lots of drops. So adding one more drop just doesn't seem like the answer. That's a great patient to use it. Or maybe you wear contact lenses and the eye doctor has always told you you had to take your contact lenses out to put your medication in, or use the medication before you wear your contact lenses. Or maybe you wear eye makeup and you don't want your eye medication causing the makeup to run down your face. So those are four patients that would really benefit using a dry eye nasal spray like Tyrvaya. So let's talk about how you can get Tyrvaya for yourself. Tyrvaya is a prescription medication, which means that you'll need to visit your eye care provider to get a prescription for it. But once you get the prescription, it is super simple to use, but also important to remember that it is not like the other nasal sprays you've used in the past for your allergies or sinuses. You're not going to take this nasal spray, shake it, and then put it up your nose and snort it into your sinuses. It's not like that at all. In fact, we tell our patients not to shake this bottle because the medication inside is preservative free. So instead, you will remove the safety clip and then remove the lid, and then the Tyrvaya does not go into the nose up. It's going to go to the side of the nose here into the nostril, and you're going to point it towards your ear, because remember, we're hitting that nerve that's coming down the nose and ending right here. Now, in our clinical trials for Tyrvaya, the number one adverse event was sneezing. 82% of the patients sneezed during the clinical trial. And so most patients will sneeze utilizing this drop if they aren't properly coached in the Tyrvaya way to spray. So there are a couple of tricks that you can use, and I've tried a bunch of them, but this by far is the best one that I'm going to teach you how to use today. So have your Kleenex by the ready and your Tyrvaya, and what you're going to do is take a deep breath in through your nose. Then you're going to spray the Tyrvaya to the side of the nostril, one side and then the other. And then once it's in, you're going to exhale out of the nose and wipe your nose. This is going to keep the Tyrvaya from going up to the sinuses and causing you to sneeze. So let's try it. There you have it. I used the spray and my eyes are already feeling moist. It happens very quickly. In the clinical trials, again, it happened within 5 minutes that patients could feel more moisture in their eyes. So Tyrvaya, a nasal spray for dry eye. Thanks for joining me today. I'm so glad that you're here learning the best ways to take care of your dry eyes so that your vision will last you a lifetime. Bye for now.